All right, surgeons, let's get into the classroom about self-concept. Okay, so what is self-concept? It is essentially how you view yourself. It is your relationship with yourself, and all roads point to self-concept. I always use this example, but it's so powerful. You can take two surgeons, okay? Two exactly the same surgeons in the same specialty. They're both doing the same amount of surgery. They both do 100 surgeries. One surgeon does 100 surgeries. The other surgeon does 100 surgeries, okay? This surgeon, surgeon one, has 10 complications, okay, out of 100. And this surgeon has a self-concept that I am an exceptional surgeon. I show up in service to my patients. I do everything I can possibly do to give them the best result, but yet they still have 10 complications. This surgeon who had 100 perfect surgeries and 10 complications will look at those 10 complications and extract value from them. They'll look at what went wrong, what went well, what would they do differently, and they'll apply it and they'll learn from it to try to make sure it doesn't happen again. Obviously, we don't always have all the control, but we can do everything that is in our control. This surgeon, surgeon two, who has a very lacking self-concept, who has imposter syndrome, who's looking for themselves to do a mistake, to prove that they don't belong, to prove that there's something wrong with them, that they are broken. This surgeon is going to look at those 10 complications and forget about the 100 successes. They're just going to look at those 10 complications and make it mean that there's something wrong with them. They're going to shame themselves. They might even start to have experiential avoidance, where they avoid certain surgeries because it reminds them of those 10 complications. They're not going to take the time to evaluate what actually happened, and they're not going to extract any value from those complications because their self-worth is so attached to it that anything that goes wrong, they're going to tell themselves there's something wrong with them. And so this is the surgeon who tells themselves the story, as long as I do everything perfectly, I can do this profession, which we all know, because we're not emotionless robots, we're actually humans. We're going to make mistakes. We are going to make errors. We are flawed. We are not perfect, okay? And that is what a lot of this module is about. That's a lot of what this set of classrooms is about, is going from the impossibly perfect surgeon, nobody is impossibly perfect, okay? No human is perfect, to the empowered imperfect surgeon, okay? You can be imperfect and you can be empowered and show up in service to your patients and take care of yourselves. And it starts with getting your self-concept clear. So self-concept is who before how. Okay, you need to know who you are before you can know how to do it. Now, you've already learned the how. You did that in residency and fellowship, okay? You learned all of the how. You know what to do. You know the steps to surgery. Doesn't mean that you can do it. But the who is, I'm the best person for the job. Just because you know how to do it doesn't mean you're going to do it. You want to get to the place where you have such belief in yourself, where you're always thinking, I'm the best person for the job, as long as it is a how that you learned in residency. The problem becomes is if we get stuck in imposter syndrome, or we get stuck in self-doubt, and we start to look at our failures and make them mean things about us, we start to attach our self-worth to our surgical outcomes, our who becomes something completely different. It alters in a way that doesn't serve us or our patients, and our world becomes very small, and our how doesn't matter. Now, let me just give you an example of who's before how, and I talked about this in my podcast, Trainee to Attending Self-Concepts. It's podcast 35. But the best example is the example of somebody who's dating. If you are a single person and you're out there dating, and you believe that you are ugly, you are not sexy, or you lack confidence, and you're looking for someone to meet your emotional needs because you can't meet them yourself, you are going to end up in a relationship that is codependent. You are going to probably settle for someone who is not the best person for you, and it's just not going to work out for you. Your how might be going on Tinder, going on Bumble, going on all of the platforms, the dating platforms, to try and meet someone. But if you're showing up with the who of, I am not good enough and I need a guy to make myself complete, I'm incomplete without a partner, you're not going to find the right person, right? Now, flip that on its head and take someone who radiates confidence and they believe in who they are. They love themselves immensely. They could take themselves out to dinner. They can take themselves out to the movies. They enjoy their own company. They love spending time alone and like reading and just being with themselves. They get dressed for themselves. They put on makeup for themselves. They self-care for themselves because it's who they are. They believe they're gorgeous and they believe they're very handsome and they think they're the sexiest thing out there, and they meet all of their own emotional needs. They think life is amazing. They're going through life just having the best time, and they're looking for someone to share that experience with. They're like, I show up, I'll meet all my own emotional needs. You show up, meet all your emotional needs. We'll get together and have fun. And so that kind of person can go on Tinder and Bumble and do all the social dating sites, and they're going to find someone totally different, and they're going to very easily know if someone is not their person because they know who they are. We have to know who we are. And it's very interesting because if you think of self-concept and you think of like angsty teenagers, a huge source of their suffering is the fact that they don't know who the hell they are. Like, they are changing. Their prefrontal cortex is evolving. It's like memories are forming. They're starting to take in all different types of information. They're growing. They're having puberty. They have all these emotions they don't know what to do with. And their sense of who they are is fluid. It's confusing and it's changing. And that causes a lot of suffering that's not fun. And so it makes sense that teenagers have such a rough time. They're almost like having an existential crisis of self-concept. But you as an adult, you are not going through puberty. You are not a teenager. You are a surgeon. You need to get very clear on who you are. You need to get clear on your self-concept. This is the foundation of everything, is self-concept work. Now, the impact of having a very solid foundational self-concept is that you'll start to take action with uncertainty or fear. Surgery is nuanced, okay? There are so many factors. There are so many moving parts that are happening. I mean, we have patients who come in with, different social situations and different health status, and we have hospital systems that have varying amounts of support and varying types of equipment that we can use. And so we have a lot of uncertainty, we have a lot of fear when it comes to taking action to operate on a patient or to help a patient. And if we know who we are, we know where our limits are, we know our capabilities, we're so much better equipped to take the next right action, given all of the uncertainty and all of the moving parts and all of the nuances of the world of surgery. We're also able to evaluate mistakes and extract value. I keep repeating this, but failure is such an important place to learn. Failure is information. And so when something doesn't go well, we want to ask ourselves, what went well? What didn't go well? And what would I do differently? This comes from my coach, Stacey Bayman. And then we can get value from that failure, from that mistake, and apply it to the next, okay? To the next time we encounter that same scenario. Contrast that to someone who has a self-concept of, I'm not good enough, I'm an imposter. As soon as something goes wrong, it'll prove to me that I don't belong here. When something goes wrong, their self-worth is going to be so wrapped up in that mistake that they can't extract value. We can't extract value when we're making mistakes mean something about us and we're in the tunnel of despair and we can't see clearly, okay? We have to very strategically detach our self-worth from our mistakes and our failures in order to evaluate them. And when you have a strong self-concept and it involves not attaching your self-worth to surgical outcomes, you're able to evaluate your mistakes and learn from them and extract value. You're also able to innovate. Every single innovator in the world of surgery has had a very strong self-concept. Again, I talk about this on my podcast, Trainee to Attending Self-Concepts. I highly recommend you go back and listen to it. It's Surgeons with Purpose, episode 35. But I give some examples of some innovators in our field. But any innovator that you look at, that's someone who knows who they are. They think they're the best person for the job. They know they have the skills, and they're encountering a problem that hasn't been solved yet, and they're able to creatively solve it and to think of something nobody else has thought of before to find a solution to that problem. They're able to innovate because their self-concept is so rock solid. And your world gets bigger. When your self-concept is shaky and you're attaching your self-worth to surgical outcomes, when something goes wrong, you will become anxious and you'll want to not do that surgery. Maybe you'll have some PTSD and maybe you completely stop doing that surgery. And so your world will get smaller and smaller. If you have a very strong, rock solid self-concept and you don't attach your self-worth to surgical outcomes, your world can expand, okay? The world can get bigger. You can learn from it, and then you can impart that knowledge on others, and you can learn how to approach those types of surgeries in a different way to create the exact outcome that you and your patients want to create. And so your world can either contract if you don't get clear on your self-concept, or your world can expand if you get clear on your self-concept and you don't attach your self-worth to surgical outcomes. Let's talk about the belief triad. I came up with this concept based on a business concept about selling essentially life coaching, which is having belief in self, belief in the offer, and belief in your client. And I was thinking, like, how can this not apply to surgeons? This absolutely can apply to surgeons. And so the way I thought about this, and this was maybe like a year ago that I came up with this, the belief triad involves belief in self. So this is your self-concept, you knowing who you are. Belief in the surgery, meaning that you think the surgery is going to help the patient. Not that you think the surgery is going to fix the patient. Not that your mentor from residency thinks that this surgery will help the patient and told you that you should do this surgery. Not that your peers think this surgery is good, but that you believe it. You believe in the surgery, and that you believe that you have all of the support and all of the tools available to do the surgery. If it is a surgery done in a tertiary care referral center, in an academic center that has all of like the most innovative tools at their fingertips, and they have all of the equipment reps ready to go, you just give them a call and they just show up. You have staff, you have techs who are just like so used to scrubbing that service, they can basically do the surgery. They're like first assists. That is a very different type of surgery, a different setting for surgery than if you're in like this little rinky-dink community hospital where you're getting like a traveling tech who's never scrubbed your service, and that you have to work with like a Bovie and like a DeBakey, right? Like you can't create the same kind of outcome. And so you have to know not just belief in the surgery, but belief in the place where the surgery is being performed, belief in the institution where you're doing the surgery. And so that is something you want to pay attention to. And then finally, belief in the patient. Is the patient healthy enough? Does the patient know the pre and post-op instructions? Do you have a good relationship with this patient? Can you communicate with them? Are you guys on the same page, or are you seeing eye to eye? Because if you're not, you may not have a good surgical outcome. You may not be able to provide the patient with the best surgical outcome. And this belief triad is so essential to get super strong prior to surgery in order for you to show up to the operating room with the most confidence. If you walk into a surgery and you have complete belief in self because you have such a strong self-concept of who you are, you know you're an exceptional surgeon, you know you can do that surgery well, you do it for yourself. If you needed that surgery, you would want to come to you, right? That is how you know you have belief in self. And you don't have to have it to that extent, but you want to be able to believe in your skills enough where you're like, I know I can execute this excellently. And then believing in the surgery, you know the surgery can help the patient, you know it's indicated, you know it's the right thing to do to serve this patient, you know you have the support for that surgery to be able to execute it well, and you believe in the patient, you know who they are, you know their health status, you can communicate with them, you have a good relationship, you have good rapport. When you have all three of these in place before you even step into the OR, you are setting yourself up for success. Because if you encounter, something's back ordered, everything's always back ordered, nobody knows your stuff, your preference card is unreadable, and you have to set up your whole room on your own. Whatever you encounter, equipment doesn't work, whatever snafu or hiccup that you walk into, whatever kind of sabotage that you walk into on the day of surgery, if you have all of these in place, you're going to be in a much better position to manage those circumstances than if you're in self-doubt, you're questioning whether the surgery is even indicated. You're like, why am I even doing this? I don't think it's going to help. Or you're like, the patient is like not the right candidate. This patient should probably not be having surgery at all. You don't want to be thinking those things. And so you have to go to each one of these components of the belief triad prior to even stepping into the operating room. And today we're focusing deeply on belief in self. This is where you start. These are so much easier, right? Belief in surgery, belief in patient, easy. We can figure that out. This is hard. Believing in ourself and our own skill, that's where the work is.